Hi, I'm Ralph Preston. I run Stroke Buddies, and every Tuesday we have, normally recovery and science meetings. This is a teeny bit off topic, but it's an important subject for a lot of us older folks. And so I thought, hey, knowledge is knowledge. It's a good thing. So I'm impressed with the number of people that are here, and today we've got my friend and colleague, Genevieve Richardson, who's a speech and language pathologist, and her friend, who I'm just meeting today, Dana Lassen, better known as Medicare Dana, and she's the expert on Medicare. And today Genevieve's going to do a little interview, and we're going to try and bring you some useful information about how Medicare works, and more importantly, we live in a world full of spammers and scammers these days, don't we? So they're everywhere, including Medicare, and Dana's on to some of the more popular tricks that they're up to. And this is a kind of an interview and discussion, and we encourage you to ask questions and contribute when you want. And one way you can do that is to put your questions in the chat, and Genevieve and I will try and manage them and get them answered for you. And the other way is you can unmute yourself and speak up. We ask that you not interrupt, but I find that it's always a lot better to. I always want to ask my question when it's happening, not 40 minutes later. Sometimes I have like 4 questions and I keep adding fingers. Okay, it's another question. And they don't seem as relevant at the end of the meeting. Anyway, I'll get quiet now and let the experts talk to you about Medicare. So Genevieve, take it away.
Thank you, Ralph, and welcome everybody to this episode. So this is going to be, I think, Dana, our 4th year doing this. And this is something that I've done on my podcast with Dana. And I've always had such great feedback that I wanted to bring this to Ralph and to Stroke Buddies so that we can get out current information. We are not going to get into the weeds and the nitty-gritty today. We are going to talk about the bigger changes that are going on with Medicare for 2026 because some things have changed. And the part that I'm most concerned with are the scams because I work with folks who have aphasia. And what I know about aphasia is when you can practice things that you're going to say or practice your thinking about a particular topic, you are much better prepared when it comes at you from left field. You answer the phone and the phone says it's Medicare.gov or whatever it will say. And if you're not prepared for what that other person is going to say, you could fall prey. And we absolutely don't want that. So that's why I wanted to add that into our talk today. So, Miss Dana, Medicare Dana, if you would catch us up, should we start with some of the key changes for what people can expect going into 2026, as this is the annual enrollment period, AEP, right?
Yeah, sure. And I can talk a little bit about the difference between the two plans. First, hello, everybody. Thank you for welcoming me. I see people that might be on Medicare themselves, people that might have under 65 Medicare or potentially have a parent. So I think it's important to just talk through the two different programs on Medicare, how people can be getting their Medicare benefits, and then we'll talk about what this particular time right now, AEP, what you need to know, and which programs need to make changes. So first is there's 2 ways that someone can get Medicare benefits. You either have original Medicare with the supplement plan and typically then a standalone prescription drug plan. So you'd have 3 cards, the red, white, and blue government Medicare card, your supplement plan, and when you go to the doctor, you give both of those cards to the doctor, and then a third standalone prescription drug plan. That's kind of one road or one avenue to get benefits. The second one is Medicare Advantage plan. To have a Medicare Advantage plan, you still need that to be enrolled in Medicare, which is that red, white, and blue card. But once you are enrolled in an Advantage plan, that card is no longer in use. And when you go to the doctor, you give one card, which is an Advantage plan. Those are going to coordinate the drug plans and some other benefits in one card. And they're very different programs. Their structure is different. Their access to different providers is different. Deductibles, copays, they're totally different. But it's important to know if you're on an Advantage plan, you're handing over one card is usually a plastic card. It might say HMO, PPO, RX on the one card. And if you're on a supplement card, you're handing two to a doctor or facility, the red, white, and blue, and the supplement card. So that's a first clarification that sometimes people don't know which plan they're on, and there is a big difference. Right now, during Medicare's annual enrollment period, AEP, which started October 15th and goes to December 7th, and that's every year. This is the one time of year to make a change to your standalone prescription drug plan or the Advantage plans. If you're on a Medicare supplement plan, which typically has a letter like F, G, N, if you're on one of those plans, the supplement plans do not change year to year. They're standardized in every state, so they're not renegotiated. The benefits and the coverage you get are the same every year. This AEP period is not for supplements. You don't need to worry about those right now.
I
But
need
it
to
is
interrupt
for
you. I am under 65 and I have Medicare due to disability. And of course, the supplement does not apply at all. So you're really speaking to something that you haven't mentioned my category at all.
I haven't yet. I'm just getting started, but I will talk about under 65. At the beginning, I did say I see some people that might be under 65 on disability, some older, and some might be with it for their parents. So I will get to that, Polly. It's a really good point, and it's going to be important for, I think, this population as well. Thank you for bringing that up. Let me just get back to my train of thought. So those are the two plans. If you are on a standalone prescription drug plan during AEP, this is the one time of year to make a change to that prescription drug plan. And if you make a change between October 15th and December 7th, that change is effective for next year. So that's for the full 2026 year. The Advantage plans similarly are changing each year. They change what they cover, what they don't, doctors included or not. And this is the one time of year to make a change. So anyone who's on Medicare, whether it's an Advantage plan or a prescription drug plan, you should have gotten in the mail what's called an annual notice of change, an ANOC letter. The ANOC letter is going to tell you for the prescription drug plan and Medicare Advantage, those are the only two plans we're talking about right now. The ANOC letter is going to tell you what changed, what is changing from 2025 into 2026. So for the prescription drug plans, some of them have increased their premiums. Some of them have changed their formularies, which is the list of medications that are covered on the plan. So in 2025, you could have a medication that was covered all year, but that plan going into 2026 might have dropped that medication from their formulary, their list of medications that they cover. So that's important. And then the tiers. So medications are tiered 1 through 6, and typically 6 is a more expensive medication, 1 is a lower cost medication. But every plan determines their tier. So a plan can tier the exact same medication. One can tier it a tier 1, and a different plan can tier it a tier 2, and then they can get different payouts for it. So you want to see that in that annual notice of change, what's happening from 2025 to 2026 to see if you need to make a change. The other thing that we're seeing is that a lot of prescription drug plans and Advantage plans are actually terminating this year. So you might get, instead of that annual notice of change, you might get a termination letter. And if you got a termination letter, That means that you have to make a change and re-enroll in a prescription drug plan or Advantage plan by the end of this year, or you won't have coverage at all into next year. And we can talk about, if you want, the details of why we're seeing that with the Inflation Reduction Act, but that's really the key right now in this period of time, Medicare's open enrollment. For folks that are under 65 that have a disability and are on Medicare, it depends on your state. So some states only offer under 65 to be a Medicare Advantage plan. Other states allow under 65 Medicare disability to purchase a supplement plan. So it really depends on your state. Regardless, though, this is still the only time of year to make a change to the prescription drug plan or to that Medicare Advantage plan, Genevieve.
That's a lot of information. So, and I thank you, Dana, for making that as clear as the government information can be. So, should we open it up? If there is some pressing question right now, drop it in the chat or raise your hand would be great if you can do a digital hand. If not, we're gonna keep moving forward. How does that sound, Ralph? We good? All right, lots to unpack there. So, how is this year different, Dana, than even last year?
Yeah.
I mean, yeah, that's a loaded
Yes.
question, I know.
Well, what happened is 2 years ago, they brought about this act called the Inflation Reduction Act. And the idea of the Inflation Reduction Act was to cap or max out-of-pocket spend for Medicare beneficiaries on their Part D, on their drug plans. And it was a 2-year kind of tiered approach. And in 2024 was the first year. And they put this cap at $8,000. So once you reached $8,000, you no longer had to spend for the rest of the year. What the Inflation Reduction Act did is it shifted the burden from the beneficiary, you guys who are on Medicare, to the insurance carrier to offset that cost. And in 2024, that cap was $8,000. And last year in 2025, that out-of-pocket cap, or what it's called TROOP, the true real out-of-pocket cost, you might see that TROOP, is $2,000 in 2025. In 2026, it's $2,100, so very close to that $2,000. That $6,000 difference between 2025 and 2024 has wreaked havoc on the prescription drug plans and the Medicare Advantage plans. Because the Medicare Advantage plans bundle, they incorporate the prescription drug plan, so they're following that same Inflation Reduction Act rules within their plan. And capping the out-of-pocket spend forced a lot of premiums to raise. The carriers had to find a way to offset the balance. However, they didn't realize, whether it's actuary misses or just complete misutilization of the funds, how much it would affect the impact. And that's why we're seeing so many terminations completely for Medicare Advantage, because they just can't continue to pay those claims. So they had to terminate the plan. We're also seeing a lot of terminations, especially, well, nationwide actually, for PPO plans, because they also were mismanaging the out-of-network costs. Because when you are on an Advantage plan, you have to pay copays and deductibles until you reach your max out-of-pocket. And once you do, the plan covers that in full. And these out-of-network costs have become astronomical. So that, in combination with the Inflation Reduction Act, we're seeing Part D plans, the drug plans, fewer carriers, some of the changes in formularies, maybe they're realizing we can't have this really expensive medication on our plan anymore. We can't fund it. So that's why you're seeing so much of that disruption, terminations, increase of premium, or maybe changes. So it's so important, even if your medication has not changed. You're on a prescription drug plan, your meds haven't changed. Please do not think I'm fine for next year. You need to go to medicare.gov and you can put all of your information into their medicare.gov portal, your zip code, your medications, and it will show you what plans are available for 2026. even if the same name is available, so you're on the same carrier plan, check your medications. Do they still cover them? Do they cover them at a cost that's okay? And if you notice 2026, everything looks good, and the same plan you're on is rolling into 2026, it's not being terminated, you don't have to do anything. You will automatically roll into it. But if your plan is either being terminated, you need to enroll in a new plan, or if when you go on Medicare.gov and you see that there's another plan, a different plan that's more cost effective, then you want to enroll in that plan.
Okay, clear as mud so far? All? I think number one, Dana, people need to open that envelope. I know when I
Yes.
see those, envelopes, maybe I'm not getting the Medicare just yet, but those envelopes that is like one of those loaded things. Like if I open this, I have to deal with it.
Yes, opening your
This
mail is
is the
huge.
time we have to deal with this for Medicare, Medicare Advantage, because there is a financial consequence. There is a healthcare consequence, right? You need to have coverage. And the sooner you can get into that and get it sorted, the sooner you're done with it. Because Medicare.gov, as we know that yesterday in Texas, we had down the whole central Texas, we had no internet because of one incident. We also saw that there was another internet provider that helps provide these support systems for all these things we do on the computer. It was also down. The sooner you can address these things and get them taken care of, they're off your plate. Do it while the tech is working, because I guarantee you said it was December 7th. December 5th, 6th, and 7th is the end of AEP.
Don't wait.
Good luck to you.
Yeah, don't
It's
wait.
going to be pretty hard to get those things sorted. So that's the other reason we're doing this now. We just opened AEP a week ago. And I have no financial thing about this. This is a public service announcement because I trust Dana. She has worked with many of my clients who have always shared her praises, and she's knowledgeable, and she's happy to be here today to share this knowledge with you. So know that there is absolutely no obligation to work with Dana. This is an information session. What's next, Dana? What's the next? I have an idea of what's next. Let's give an example. My parents are on Medicare Advantage, and they got their letter, they opened it and said their plan is being terminated.
So this is a interesting and special issue. If you are 65 or older and you're on an Advantage plan that got terminated, you have a special opportunity to join to switch your Advantage plan to a Medicare supplement plan without medical underwriting. What that means is if you have a health ailment that is chronic or that is one of every Medicare company has a list of underwriting questions. And typically, they are some of the more chronic illnesses. So sometimes someone's on an Advantage plan, they have a chronic illness, they can't go back into original Medicare and the supplement plan because they underwrite and they would become declinable. But if an Advantage plan is terminated, you get this guaranteed right to switch to a Medicare supplement plan without medical underwriting. That may not be the best case for you, but it's like this golden ticket opportunity. So I would say find an agent. It could be a local agent. It could be someone that someone else recommends. Don't just Google. Find an agent that someone knows and recommends that can walk you through what it would look like, what the options are. And it's just important that you don't let that termination letter get forgotten about, because January 1st, you will not have coverage. So that is a huge thing. And it, like we said, it's happening nationwide. So we want to get that out to as many people. Check in with your folks, check in with the community. You should have had that information. Opening your mail is huge right now because of the letters that are coming. But the other thing that I just want to kind of put in the back of your mind We talked a little bit about scams and protecting yourself. What we're seeing a lot of, well, every year during this time, anyone who's on Medicare, whether you're under 65 or over, is very much targeted. You are getting calls, you're getting bombarded. You've got radio, you've got TV, there's advertisements left and right. Most often, anything for free or that looks too good to be true is. So, all of what is getting kind of thrown at you is a lot of clickbait so that they can get you on the phone and then they can switch you. A lot of times they're call centers, they're not independent agents. You want an independent agent and an agent, so that's your point person. There's no more money that you spend when you work with an agent than when you go directly to a carrier. Some people don't know that. Instead, what it is you just get a one-on-one relationship. Ideally, I know my clients from once they start with me for years to come. So we build a relationship. They have a question, a billing, an issue, they've got a point person. If you go direct to the carrier, you have to call their 1-800 number, get rerouted. There's not that more intimate relationship and not as much guidance. So, what these carriers are trying to do, and what a lot of scammers are trying to do, is get in touch with you for two reasons. If they're a scammer, and scams now have gotten so high level that on your caller ID, it might look like an insurance company, it might look like the government. It's not. These are spoofs. They're trying to, on one end, get your Medicare number. Hold that on for dear life, like that is cash, credit card, because on the back end, what they can do is scam Medicare with your number. That's how a lot of the Medicare scams happen on a larger scale. They can try to get funds and scam you. What we're also seeing though is a lot of the insurance carriers, their call centers are calling you. Whether it's your prescription drug plan, they might be calling to verify your member ID. And then what they're trying to do is switch you into another plan. If you've been on the books, if you have a prescription drug plan or a Medicare Advantage plan or a Medicare supplement plan, those carriers have all of your information. They should never be asking you to verify your member ID, verify your Medicare number. You've been on their books. So if you can kind of remember that, because it throws us off. Sure, I've got company B. They're calling to confirm. I know I have them. I'll just give them the information. No, they should have that. There's no reason for them to call you. What they're doing is trying to get that information, switch you to a new plan. And if that happens and you do have an agent, for example, we can no longer help. We can't escalate that. But also, they could switch you to a plan where your medications or your doctors are no longer covered and you don't even know what's happening. So just be very careful. If anyone is calling you, if anyone's asking you to give any information, you can just say, no thanks, and hang up.
Polly's got her hand up, and we've got a question from Joan in the chat, and either Genevieve or I can read it, or if Joan wants to ask it direct, she can unmute herself. But Polly's hand was up first, so go, Polly.
We can let Joan go ahead.
Oh, okay.
Joan,
Do you want
do you want me to read it or you want to?
Oh, it's okay. Yeah, so my husband's on Medicare disability. He turned 65 tomorrow, and we have Part A and B. He's had that for a while now. We really don't use it because he's on my insurance for my work. So I wondered if there's anything we should be doing now that he's turning 65, but I'm still working. So what do we do? Anything?
That's a great question. So now that he's 65, he will get a guaranteed issue to get a supplement plan, no medical underwriting. It would be important to look at how much your group insurance is because Part B he's paying for anyways.
Right.
So you would want to do like a cross comparison. Look at what are your costs of the employer plan versus the plan that the Medicare plan. But the other thing is you only have 6 months from that Part B effective date, which he's going to get a new one for turning 65, to be able to enroll in a supplement plan without medical underwriting. So if there are some medical, which it sounds like there are, the guidance would be to switch him fully into Medicare and drop your employer plan You want to look at meds too to see those costs, but because otherwise he could be in a position where he's not going to be able to have the opportunity to get the coverage that he might want.
Right. Okay.
And that would be something that happy to walk you through just to look at the cost and kind of what
Mhm.
that timeline would be. If he's on really expensive medications, that would be something to look at. And he, like I said, he's got 6 months from Part B. So it's something that we could look at towards the end of that 6 month, making sure he gets switched over so that there's no issues in terms of his
Okay.
ability to get that coverage that he needs.
Okay. Yeah. Thankfully, he's not on any expensive medications. It's just the basic heart medicine and that sort of thing. So yeah, my insurance is pretty good and it covers all that. So, but yeah, I should compare it then. Okay. Thank you.
It's a
Well,
great question.
I went to a private person and their advice to me, I was going to ask you if it was good advice, but based on your answer, Dana, it sounds like it was that she said that it was important to sign up for everything when you could and stay signed up and make sure that you made changes at the proper time because my understanding was there are a lot of nuances to the whole thing, and if you're not careful, you can end up working against yourself or not doing the right thing. So it sounds like that was good advice.
That's true, but I would put a caveat in here.
Okay? That's
Medicare is really nuanced based on situation. So, what gets a lot of people in trouble is someone saying you have to do X, Y, and Z or you'll get penalized, which might have been true for their situation. People working past 65, some can delay Medicare without penalty, but it depends on how many people are working in their company. People who are working for a company most time are suggested to get Part A because you've already paid into it and it's free, but not if you're contributing to a health savings account because there's a tax penalty. So there's so many nuances. I would tell anybody approaching Medicare, talk to an expert because when someone gives the wrong advice or someone looks it up online and it's confusing, they don't make it that easy. And they do enroll in A or B when they shouldn't have. It's very hard to get that rectified, and you might be starting to get charged. Or if they missed the window and they were supposed to, you will get what's called a late enrollment penalty that Medicare puts on as an added premium monthly for life, which is insane, but it's true. So you really, really want to work with someone. I always say 64, 64 and a half if you are approaching Medicare when you're 65, because you want to make sure that you're on the right path so you don't do something inappropriately that could cause you, a charge for life. And then if you're looking at disability, you want to talk to someone as you're about to get that disability come through so you also understand what you may or may not need to do in terms of Medicare under 65.
And one thing I love about you, Dana, is that you will outline this as a step-by-step process because there are, just like you explained, there's so many nuances and everybody's situation is going to be a little bit different.
Yes.
Polly, did you want to ask a question?
I really haven't heard you say much. The things you're saying don't apply to me as someone with Medicare from disability and someone who, like Joan's husband, is covered by an employee plan through a relative. So my Medicare is secondary. I can't get a supplement. And I also wanted to know why you haven't mentioned the Medicare ship.
So I think, Polly, I'm trying to give some general information. I did touch upon disability, so I'm not sure exactly where you're feeling like I'm not addressing those needs. Disability is a little bit more complicated in certain states because in certain states, like Polly was addressing, and I had mentioned previously, the only option are Advantage plans, but in other states, you can get supplement plans. With Medicare, especially disability, it's different than when you turn 65. So an employer plan can be primary, Medicare can be secondary, or vice versa with that. So it's a little bit more specific in terms of the type of coverage that you can get. But this is open enrollment. So someone who is on a under 65 plan that doesn't have an employer plan as in working in combination would need to make sure that they're checking their Medicare Advantage plan for changes, just like anyone else. So that is something that I hope was highlighted prior. I will focus a little bit more to make sure everyone hears that. If you are on a under 65 disability Medicare Advantage plan, you still have an AEP. This is that one time to make that change. The SHIP counselors they are counselors through Medicare.gov that are there to have some guidance. They are not licensed agents, so it's not something as an independent broker. My job is very different than a SHIP counselor.
A little more in depth, a little more personalized.
I got a question, and I'm really not prying into Polly's situation, but I'm wondering if it applies to other stroke survivors who aren't 65 or on disability part. Are you not, or if that's the case, are you not allowed to get a supplemental plan, or Polly, is there something special about your circumstances? I'm just curious if it's something that other under 65 on disability stroke survivors should, know about.
In many states, your only options with Medicare under 65 are original Medicare or an Advantage plan. You do not have an option. In Virginia, we do not have an option to purchase a supplement.
Okay, so that's something that Virginia is imposing on you as opposed to something that is personal to your situation.
It's the whole thing is kind of confusing, and even though it's a federal program, all of the Advantage plans are state specific as well.
Right.
So it can be, but I know that it's not just Virginia because we've been having discussions about the cost of botulinum toxin injections and how people are limited. They have to get an Advantage plan, which doesn't provide the same kind of coverage as original Medicare. But if you only have original Medicare, then there's no end to the copays because there's no out-of-pocket limit. So I just think that someone should maybe start with a SHIP counselor because the other problem I'm having is the claim information online with Medicare is processed incorrectly for Part B claims from a medical system. So when I go to physical therapy at VCU, the claims that are displayed on Medicare.gov are incorrect, and I have to wait until the Medicare summary notice to see the correct information because the claim is processed as if Medicare were primary, except it's just a mess. And I have spoken with an agent that I was connected through my brain injury counselor with an agent that they had great confidence in who couldn't figure it out. I've spent hours on the phone with Medicare and they can't figure it out. I've worked with the SHIP counselor and they can't figure it out. And we finally figured it out after 5 years.
So I'm so sorry to hear that experience. Something that you just said is something I want to offer up to everyone as a resource. Many times Social Security is overwhelmed. lots of times maybe the education isn't always there. So if any of you have experienced calling and talking to three different people and getting three different answers, maybe none of them being correct, it's just an overwhelmed, overworked space. And I always try to say we can control what we can control and utilize resources where we can't. So one really great resource, and Polly, if you need this going forward, it sounds like now after a very long time, you've gotten some stuff figured out, but is to email your local congressman. You can do this by going to www.house.gov. If Genevieve, if you want to throw that in the chat, if you go to www.house.gov, in the upper right-hand corner, you can put in your zip code. When you put your zip code in, you'll put in your address and it's going to show you who your local representative is. You can click to email them or look at their website to then email them. Email them your issues, whether it's with Social Security, Medicare, prescription drug plan, MAPD plan. I have had a lot of clients get success from this because at a certain point when you do the runaround, there's not many more places you can go if you're calling, if you're escalating, if you're talking to a supervisor, if there's still errors. And these local congressmen that you have voted in, they number one want to hear what's going on. They don't know. They don't have boots on the ground, but they have direct connections and they have resolved things quicker for clients that have issues with Social Security. As an independent agent, as a broker, the broker community, we cannot do anything if it's Social Security that needs to make the change or Medicare. And so this is a really wonderful resource for you. I suggest think about it in as easy, simple terms, bullet points. This is my issue. I called Social Security or I called the person on this time, blah, blah, blah. Here's what I need you to do. And I have seen them get lots of results. So just a resource for you if you feel like you're getting this crazy runaround or there's an issue or, they've even shut off people's Part B completely in error and there's nothing that we can do. They got to do it. And so having this resource is really helpful for all of you guys if you ever need to fall back on it.
Thank you, Dana, for giving another resource. Can we shift to scams? I want folks to understand what the nature of some of these phone calls could be. And first, I want to emphasize that something you said to me before we decided to do this and bring all of you into it is that the government knows who you are. Your insurance plan knows who you are. They don't need your birthday. They don't need your plan number. They don't need your address. They know who you are. And they know who you are because they mail you stuff. And the government does not have a call center that's going to be calling you. So I want to make this absolutely clear. One of my very good friends just got scammed on the phone. She thought it was AT&T calling because her phone said AT&T. So she believed that that's what it was. And so even if your caller ID says it's Medicare calling, they're not. That is your first clue. And that's why I want to go through some of these. So Dana, let's bust some myths. Can we try it this way? And if you guys have questions, if you've heard any of these, let us know. Put your hand up, speak up. And if you've heard of something different, let us know that too. Hey, Dana, I have a lot of my clients who complain about that paper card. It would be so nice to have an original Medicare card that's plastic, that doesn't get ripped and torn and yucky in my wallet. Can I get a new plastic Medicare card?
No, and that scam of people calling you, telling you that there's new plastic ones coming out is just that, a scam. They stopped the plastic cards a long time ago. They're paper cards, but there is a huge scam where there are people, it's not the government, calling to try to get your Medicare number so that they can have your Medicare card. And they'll tell you, oh, there's a new plastic card, it's coming. Your card's going to be ineffective if you don't switch to this new card. They are trying to scare you. If we don't confirm your card, we can't send it to you. And now you're not going to have benefits. They're going to cut off your benefits. These are things that they're saying that are not true. And it scares you. And so it's easy to fall prey to that. But they are not calling you. Also, we just talked about how completely overwhelmed Social Security and Medicare is. They're certainly not making outbound calls. So that's a good reminder. If anyone calls and says they're calling from Medicare, they're not. That's also a scam. Some agents might say that, or a call center to try to get you to talk to them about what plan you're on, but Medicare will not call you. There is not a new plastic card. Your card benefits are also not getting shut down. Nothing about that is accurate.
But Dana, I had a phone call that said I'm going to get my new AFO, my new leg brace, for free. And all I have to do is confirm my plan number and my date of birth.
Another scam. Anyone calling saying you will get free equipment, free anything, we just need to verify your Medicare card is a scam. Any type of this for that, but also just anyone asking for your Medicare number, your plan membership ID. Let me verify. Oh, we've got free wheelchair, free XYZ, free gym membership. If you verify your information, we'll send you grocery cards. None of that is valid. None of it. Other things that you might see that aren't necessarily fully Medicare, but are big scams that are easy to get caught into. It's not just over the phone, it's email and text. UPS has a really big one out there where they'll say, oh, we just missed you for your delivery. Click here and fill out this information. False. FedEx, UPS, huge. You'll get an email from it. The emails and the text, they look very valid. They look very valid. And so it's really hard, but you don't want to click on it because if you click on it, that could get malware, which is basically like a virus in your phone and in your computer. And then they can be in there. And that's how they can also grab information in your phone or in your computer. So don't click on anything. UPS, FedEx, they also are not messaging you. Typically, if you missed a delivery, there's a flyer from one of the carriers that tells you, right? They're not texting or emailing you, but we get so caught up. Ooh, I got a package. Let me check who sent me a package. You get excited and you're doing it. So don't do that. The other thing that we're seeing a lot just in the community is parking. I know in Austin, on Austin police website, they're showing this too, that the same type of interaction that the scammers are doing for post office and FedEx are doing it for parking, for text dot, for, oh, you've got,
Unpaid parking or unpaid tolls. I
that's
got
right.
one last week.
That's right. All of those are not valid. So
That's right.
I think a couple things. If you get any type of information that seems weird, go to the actual source. Go to TxDOT, go to parking. And that's why they're having it show up on a lot of these websites because they're so rampant. But go to that person. There's also a lot of AI scams right now that are tying into financial scams. So with AI, people can spoof your family members, your grandchildren, your niece, your nephew, your kids, and they might call and it sound like them. Maybe they got a clip from Facebook or Instagram or TikTok. And so they might call and it be, or even a text like, Grandma, Aunt, please don't tell Mom I'm in so much trouble. I need help. I need money. I'll explain everything later. Don't do it. Hang up, call the person. This is happening more often than we'd like to admit. With people that know ahead of time this might be happening, you just get lost in it. So these are just good reminders that these are things that might come across your phone, your lap, your email, your text, just to be prepared that If you start to think more often than not, someone randomly reaching out to you is probably a scam. If you have text, you might see like someone say, "Hey Trent, haven't heard from you in a bit." You're like, who? They make it
what are you
sound like they're
doing?
nice, like
Yeah.
they're your friend, and that's a scam. Yes, Ralph?
And remember, one of the most important things in life, if it walks like a duck and it quacks like a duck, it's probably a duck.
That's
And
right.
if it's not, it's not. It's a
And on your
platypus.
phone, a
More
lot of
like
times it'll
more.
say likely spam or junk. Don't even open it. If you have an iPhone, you can just delete and say send as junk. If you don't have someone's name in there and they're not saying, "Hi Trent, this is Dana. I did a Medicare thing, blah, blah, blah. Now I'm talking to you." If it's just, "Hi, how are you? Haven't talked in a while." It's from a random number. They're trying to engage you and then they're trying for you to, you know, hit some sort of a link and potentially get malware into your phone or laptop.
Thank you for that, Dana. So I think we're going to wrap this up. I don't see any other questions. If you have a question, pop it up. But let's review some of the high points of what we covered today. Open up that letter. I know you don't want to. I know you don't want to deal with it. Deal with it anyway. Get it over with. Work with somebody you can trust to get answers. If you want to work with someone like Dana, there you can find that person in your area. Some agents cross state lines. Find the person you trust. Like Dana said earlier, work with somebody from a recommendation you got from a friend, right? Don't get on Google. Don't just go eeny, meeny, miny, mo and pick somebody. Try and get a recommendation. Ask your neighbors, ask your friends, ask your family, and do that. Uh, Treat your Medicare card, your insurance cards as if they are money, as if that is a direct link to your checking account. Don't let people get it, and you're not going to get a plastic one. I'm sorry, it's not in the cards this year. Verify, you know what? I'm not even going to say verify messages you get. If somebody calls you and says, this is Medicare or this is your Medicare Advantage plan, say, I'm sorry I can't talk right now. I'll call you back and hang up the phone. I'm giving you permission and I'm saying this very specific. Hang up the phone. Who cares if they think you're rude? It is likely a scammer on the end of that phone. Okay. And so what do you do instead? Look up the phone number for your insurance company and call them directly. That allows you to be in control and to make decisions and to get the information that you need. People are, these plans and Medicare, they don't have the time to be calling you. So just believe that. Dana, you also gave me a phone number and an email address that if you do suspect a scam, if you want to report it, there is, and I'll put it in the chat here, reportfraud.ftc.gov. And you can also forward suspicious texts to 7726. And that is spelled out as spam. So I'll put that in there. Okay, we covered a lot of ground today. Everybody's situation is unique. We are using this as an opportunity to talk some of this through because the more you can hear it, hopefully the better it is to process it, and you've come away from the session with some new information that can help your life or someone that you love because now you have more information. Anything else to wrap us up, Ralph and Dana?
I just have one quick question and one quick statement, and that's if somebody chooses, I will put Dana's information and the report number and your contact information, Genevieve, and anything else that you would like to see associated with us on the YouTube channel. I'll put it in the description, so if people want to reach out to you or Dana or report a scam, that they can do so. And my quick question, that was a statement first. Quick question is, just so people know, I know Dana's authorized in Texas, but we mentioned that some people have interstate licensure and stuff. So I was just going to ask her real quick to talk about who can work for her, because she doesn't work in Illinois. There's no point in somebody from Illinois contacting her.
Yeah, so I'm nationwide. I don't currently have every single state. I've got Texas, Florida, Illinois, Pennsylvania, New Mexico, Georgia, Maryland, North Carolina, South Carolina, Tennessee, California, Indiana, Utah, New Jersey, Idaho, Ohio, Vermont, Oklahoma, New York, and Nevada. I am part of, so it's a lot. I am part of a national association for insurance and benefit professionals, and we're nationwide. And part of what we do, just to kind of also give everyone a little bit more background of me, we lobby a lot with Congress. We're really trying to bring Congress boots on the ground. They don't know. Kind of why I'm telling you also www.house.gov. They just don't know what's happening on the ground level. And there's a lot with Medicare that we are trying to get them to change, but change takes a very long time. But because I'm part of this very large national organization, I do have someone in any state. If I'm not licensed, or if I can't pick up a non-resident license, or if there's a state that's a little trickier, I've got people that I can at least warmly hand someone off as an introduction. So feel free to reach out. With that said, of course, right now AEP is the craziest time. Think like CPA with tax season. But generally speaking, I would much rather be able to hand you to someone who can take care of you in that regard. And if you're working with someone locally, that relationship is so important. That's a lot of this is work with an individual. They will have your hopefully best interests at heart, and they are who you can call and walk through what these changes are. And hopefully they've been getting in touch with you, especially during this time of year, to help you through the changes for next year.
Well, I was just say, give me that list and I'll put it so we don't get people that where it doesn't apply. But the list got long, and you also said you had associates, so we'll just put your contact information without the caveat.
Ralph, this is Bruce.
Yes.
Bruce, yeah, I thought I just might say something. I live in Wisconsin, and there is an agency in Wisconsin called Informed Choice. And I work with the person there to select supplementals and drug plans and so on. They are in Wisconsin, and I think they're in other states as well, but I do not know. Oh, my wife just said, nope, they're just in Wisconsin.
Well, we
Anyway, but that's a group that's helped me an awful lot.
cool. Are they
Great.
like nonprofit type thing, or are they?
Well, I don't know if they're a nonprofit, but
Oh, okay,
I do not pay them anything. There's no bill.
right.
I
Well,
think
so
they may
Bill,
be paid by I don't know who or how, but I get no bill at all, and they helped me select a supplemental plan and a drug plan that was really important. When I listed my medications, this woman looked them over and said, well, if you go with Walgreens, it'll cost you $1,000 a month or whatever. If you go with whatever, it's this, something else, that. If you go with Pick and Save, it's free. So that's what I chose.
Okay, gotcha. Well, actually, what you're kind of doing is, so they sound like they're similar to what Dana does, and what you basically have done is reinforce what she was saying is important about working with somebody personally. And you have to dig, it's like anything, you have to dig down to what works for you. It's not like a hospital, Johnny, one size fits all. And you'd be wise. My big takeaway from this is you'd be real wise to find a qualified expert and dig down in terms of your own case and get something that works for you. That's the if I had to sum it all up in one sentence, that would be
There
it.
it is, Ralph.
So it,
Dana, thank you. Thank you for spending the time with us today, answering some questions, giving us some good information. And thank you all for being here today. And for those who registered, we will make sure you get a link to the replay.
And I want to thank both of you. I just met Dana today, but Dana, thank you very much. It was very informational and appreciate you taking the time. And thank you, Genevieve, for making me aware of it. I'm happy to, I'm a conduit, and this is a good subject that impacts a lot of people, and I'm happy to have it pass through me to the stroke community. So thank both of you very much. And for everybody who didn't hear it the first time out there in YouTube land or in this audience, all the information you need to reach out will be in the description underneath the video with clickable links to make it easy. So once again, thank you, ladies. And
Thank you, Ralph.
have a
Bye,
great
everybody.
rest of your
Take
day.
care.
Bye.